Hey everybody, how you doing? Welcome to Fatso Radio, episode number 73. I think in the episode I actually say 72, but it is episode 73, and I'm very excited to share with you all my discussion with Dr. Alvin Danenberg. He likes to go by Dr. Al or just Al Danenberg, but Dr. Al has many years of experience, a wealth of knowledge, a wealth of just understanding on health in dentistry. He's a periodontist, of course. So a dentist first, and then specializing in the gums and in the disease of the gums and all that. So we have a great conversation. He's so honest with me. He's so open with me, and it's my pleasure for him. It's my pleasure to host him in my humble podcast. So please put your hands together and welcome Dr. Al Danenberg to the Fatso Radio airwaves. But before that, please always check out VolpeMartialArts.com. Volpe Martial Arts is KW's, that's Kitchener-Waterloo's hottest, newest Kung Fu and Hapkido martial arts school. It's an amazing fusion of Kung Fu and Hapkido. So a self-defense kind of heavy martial art in Hapkido, and then a very forms and weapons heavy martial art in Kung Fu. The combination is amazing. The Sifu, my brother, Sifu Adam, is amazing. Check them out. They're always 2 weeks free trial. Check them out right now. We're actually going back into the facility and working out again after all this quarantine. We're so happy to get back together. So happy to kick each other's butt. Just kidding. It's all about self-defense. It's all about discipline. It's all about respect, folks. So check it out. And don't forget to say hi to Sifu Adam from me, my brother. Also, this episode is brought to you by Papa Earth. PapaEarth.ca. PapaEarth.ca is Canadian-sourced meat, fish, poultry from Alberta and Ontario, delivered right to your door. If you're in Alberta and you're in Ontario, give them a shout. And don't forget to use the code word Fatso Meat. Fatso Meat will save you $10 off a small box or $20 off a big box. Folks, I'm very excited to bring Dr. Al Danenberg to the show. Like I said, a lot of experience, a lot of knowledge, and I'm so humbled that he shared his time with me. So put your hands together and welcome him to the show and show him a lot of love. I love you all. Lily, take it away. Fatso Radio.
Fatso Radio, the really great podcast show.
Fatso Radio, the really great podcast show.
So get your butt and get in your chair.
Don't eat your nails and don't pull your hair.
We'll talk about chicken or talk about steak.
We'll talk about fat, for goodness sake.
Fatso, the really great podcast show.
Fatso, our very first podcast show.
Hey everybody, welcome to Fatso Radio, episode number 72. And tonight, folks, have a very special guest, another special guest, Dr. Alvin Danenberg. Dr. Al, how do you like to be referred to?
Yeah, Al is perfect. Alvin is like terrible.
Well, welcome to the show, Doc. Thank you so much.
Yeah. Thank you. Thanks for the invite. And it's a real pleasure to be on with you. Thanks.
Awesome. Thank you so much. So, Doc, I want to kind of get right into it. I appreciate your time, and I know we're kind of on a bit of a tight schedule here, but let's get right into it. Your background, maybe even how you got into dentistry itself, and then what's changed over the years. You had some illness, of course, you understand illness, and then how your diet is playing into that, and kind of how we got to today, if we can. Thank you.
Sure. So I'm going to go back a long time ago because I'm 73 years old now. So I'm a dentist. I got excited about the medical profession, loved the idea of dentistry, met some dentists, very influential in my college days, went into the program and became a general dentist. Didn't like the idea of just being a general dentist. I wanted to specialize, so I took another 2 years to become a periodontist, which is a specialty of general dentistry, and that is I specialize in the gum infections and bone infections of the jaw and the jaw joint, and this is what I've been doing, and I've got my certification in periodontics. I think it was 1974-ish. Okay. So I've been doing this for over 44 years. So practicing periodontics was fun. I loved it. I was conventional. Everything was great. A bunch of years went by. I was 59 years old at some point in time, and I had a stroke. And I had a stroke at the age of 59. I thought I was healthy. Obviously, I wasn't. I'm only 5'7", and I weighed about 187 pounds. It's a little chunky. Didn't really realize so much about that. I thought I was eating healthy, but I was eating lots of carbs and lots of sugar, and I don't even know how I consider it healthy, but that's what I thought. I was jogging. I was exercising several times a week, but certainly my lifestyle was the typical standard American type of diet, and I had a stroke. So I had this stroke, and obviously my conventional physicians saved my life, and they put me on 7 medicines for the rest of my life. I didn't like that idea. I asked them questions like, why did I have a stroke? What can I do to prevent this? Why do I have to take all these medicines? They said, well, you have to take these medicines for the rest of your life. That's it. That's the end of the story. I don't know why you had a stroke. Maybe you should eat healthier and live a better lifestyle, but that didn't mean anything.
No.
So I went to research, unfortunately, the typical organizations that a person might go to. I went to the American Heart Association, American Diabetes Association, American Cancer Society. I was looking for answers as to what happened to this guy, me, and I have a stroke at an early age of 59. Fortunately, there was no real disturbances in my ability to do anything after I recovered. It only took maybe 6 weeks or so to recover.
Wow.
So I started following the guidelines of these organizations, and I was eating differently, maybe I was exercising differently, but from the age of 59 to 66, I still weighed in the neighborhood of 180-ish pounds, and I was still on 7 medications. At the age of 66, I found a course, a 5-day course at the Paleio Center for Yoga and Health, of all places, and it was for healthcare professionals on nutrition. I thought, I'm going to just learn everything that I need to learn. It's going to confirm everything I'm doing, and I'll just be a happier guy. So I went to this course, 5 days. It blew me away, and I learned that basically everything I was doing was wrong. I learned about primal nutrition and primal stuff. I had never heard the terms before. Certainly, it didn't come up with all these other medical organizations. So I figured this made sense to me, basically a paleo diet. So what I did was, at the end of the week, I would call my wife, and I said, you know, I'm coming home. I have some ideas. I'd like to make some changes. So when I got home, she and I bumped heads for a little while. And then she got in agreement. She gave me 30 days to test out what I want to do. So we moved all of the foods that weren't paleo and put them in grocery bags. I had 7 bag groceries that we took to the food bank, and basically nothing in the kitchen pantry or a freezer at that point. So we needed to just do shopping. And then I learned how to shop. I learned to shop for vegetables I didn't know anything about. I entered the organic label meant. I found that wild fish and pastured meat was so totally different than conventional stuff. So I learned how to eat and live on a paleo type of diet and lifestyle. So from that point to another 2 years, from 66 to 68, I did extremely well. Obviously, my wife allowed me to continue more than 30 days. And so I started losing weight. I lost almost 30 to 35 pounds in that period of time without trying to lose weight, as we discussed earlier. When you eat healthy and your hormones balance, you don't even have to think about it. Your body actually compensates and removes all that excess fat. And I actually weaned off of all 7 medications within those 2 years. Well, that's amazing.
That
I
is
thought.
amazing.
I was extremely healthy, physically, mentally. I was now incorporating these concepts in the way I treated gum disease with my patients. And the ones that accepted what I recommended were getting phenomenal results. Did some more education. I actually got a certification as a certified primal health coach and a certified functional medicine practitioner. Did a few other things, was writing and lecturing and doing consults from all over the world, as well as seeing patients locally in where I was working. So I'm doing this, and we'll continue for another 5+ years. So the age of 71, it's April 19th, 2018, I'm 71. I am traveling from Charleston, South Carolina, where I live, to Austin, Texas, to speak at the Paleio FF meeting. and I had to go through Atlanta to get anywhere. And so when I got to Atlanta, and generally I carry my bags on my shoulder and walk from concourse to concourse. And I started to notice that my shoulder was just sore. I didn't know why. I figured I pulled a ligament or whatever. I went to the meeting, did my talk, came back to Charleston home, and the soreness never went away. And then it seemed to go back into my back, and then it seemed to go to my chest. And for the most part, I was achy, and I've never been this way. So I'm a hardhead. So it took a little while until August of 2018 for me to make an appointment with my medical doctor. And he and I go way back, and he's been my doctor for 35 plus years. So I go to my doctor, and I explain to him I'm sore, and he looks at me, and he pokes and prods and bounces on me, and he said, "Yeah, you're sore here." And I said, "Yeah, of course. That's why I'm here." He said, "Let's do some blood tests." So we do blood tests, and the basic tests, the chemistries, the CBC, the blood cells, it looks normal, except it also does a CRP test, and that indicates maybe inflammation. So that test comes back abnormal. It's the only test that was abnormal. Normally, I run a very low CRP, basically less than 0.5. This over 5. Something's wrong. It doesn't tell you inflammation is. It doesn't tell you if it's acute. It doesn't tell you chronic. It says you've got inflammation. Your body shouldn't have it. Let's check it out. So he suggests an MRI just to see what's going on. So we do an MRI, and it comes back. He calls me on the phone, and he says, "You want to come in the office? We'll talk, or do you talk over the phone?" I said, "Come on, Billy, just talk over the phone. What could it be?" Well, he said, I see a couple cracked ribs. I see a vertebral compression fracture. I see a hairline crack in your pelvis, and there's a big soft tissue mass about 2 or 3 centimeters big on the side of your spine. What did you do? Did you fall steps? Did you get beaten up? I said, of course, I'm just walking the shoulder, and I thought I tore a cuff, or your rotator cuff. Mm-hmm. He says, and he gets very serious now. He says, I would be serious. I would be concerned if I were you. I think it's either lymphoma, leukemia, or multiple myeloma. None of these doors I wanted to open came as a total shock to me, because I felt at that point, before that, the senior poster board, a healthy lifestyle. And here I am with a life-threatening diagnosis of a cancer. Wow. So he says, we'll need to do some more tests. I'm going to get you to an oncologist. Let's see what's going on. We did all these tests, PET scan that shows where cancer cells might be. It's loaded in my body. And a biopsy of the soft tissue mass and a few other tests. And I see my oncologist. My wife is there. My 2 adult kids are there. And he tells me I have IgA kappa light chain multiple myeloma. It's a big term for a severe case of a bone marrow cancer of plasma cells. It's incurable, and if I do nothing, he expects me to die within 3 to 6 months. 3 to 6 months. Now, I have chest pain because of this problem, but come on, how could this happen to me? I'm 71, very healthy. So, obviously not. So, he tells me we just start cocktail chemotherapy drugs right away. You'll go into remission, and you'll feel fine after you go into remission. And unfortunately, the disease will come back. We'll need a new cocktail of drugs. It'll be more caustic because the original wouldn't work any longer. And I would go back and forth like this until none of the drugs were working. I was not a good candidate for stem cell therapy, and basically, I would eventually die from multiple myeloma. And again, none of this is true. So I'm asking him, well, how am I going to feel? And he said, well, when you're on these chemotherapy drugs, many people have a decrease in their quality of life, and it goes down over time. And I said, I totally rejecting chemotherapy. If I'm going to die from this disease, I want to have the highest quality of life that I can have, even if I'm going to live 3 to 6 months. If I'm feeling like this, without the pain in my chest, and then I die, I'm okay. I really am okay. But I'm not going to live with chemotherapy destroying my life quality and my whole lifestyle going downhill for X years. I'm not interested in longevity. So he agrees with me. He's a great physician, but he is a conventional oncologist, and he basically um, tells me, okay, we'll do radiation on your chest just to take care of the pain, won't solve the cancer. So I do that, and that at least I can breathe. And then I'm investigating alternative cancer protocols. So I see an integrative physician not far from where I live. He puts me on 60 or 70 supplements. Supplements are crazy. I did that for maybe 3 to 4 months. Finally, I felt this was not working. It didn't make sense. Everything is synthetic. And then I look at the ingredient labels on these supplements, and they're including all kinds of bad chemicals. And if I took one capsule, it's bad, but I'm taking that one capsule times 60 to 80, I'm poisoning my gut microbiome. And he's not even talking to me about diet. So I fire the guy and I do more research. So I've created these protocols, which we can get into later.
Yeah.
And I'm doing extremely well. Actually, my chemistries are good. My blood work is good. I'm not getting worse, but I'm not getting better.
Mhm.
I do have the potential for more pathological fractures because my bone structure is very, very damaged throughout my skeleton. It's like a very serious osteoporosis lesions, and I am prone to easy and frequent fractures, which I've had many.
Wow.
So let's fast forward to maybe August of 2019. And I'm standing in my bathroom, brushing and flossing my teeth, which I kind of know how to do.
Yeah.
And my feet are planted on the ground, and I turn slightly to the left to throw the dental floss away. Now you have to understand, I know my bones are fragile, but I don't know how fragile is. So I literally twist to the left 90 degrees, and my right femur snaps in half. I collapse to the floor. I break 2 more ribs and fracture my right humerus in half. I am literally writhing with pain on the floor. I can't move. I mean, half of my body is broken.
Oh.
And I'm screaming. My wife runs in. She's an RN. Obviously, there's a huge amount of emotion involved here. And she calls EMS, and they eventually get me into a gurney and get me to the hospital. I am in so much pain, and have lived much longer than my prognosis, and I'm ready to die, and I want to die. I really want to die because I can't understand how I could survive with a quality of life with my entire right side of my body fractured like it was. When I get to the hospital, they fix my right femur because if I didn't do anything, I would have bled to death because of the femoral artery would have been ruptured. So they fix that. They don't fix my arm. I refuse other treatment, and they send me to a hospital to die. Now, this is the end of August, the beginning of September, and there's a hurricane coming through Charleston just at that time, and it's only moving about a mile an hour, but 187-mile-an-hour winds, and the hospital is ordered to evacuate, and they don't know where to put me, and my wife scrambles to get a hospital bed at the house. So they evacuate me to the house. The hurricane comes, the power goes out for 13 hours or so. By the way, hospital beds are electric, so they don't move. I can't move. There's no light. It's over 90 degrees outside, hot and sticky inside.
Oh, man.
It is miserable, and I'm still in hospice. And again, I'm ready to die. Now, my wife, who is wonderful and a pillar for my life, basically kind of gave me some tough love, and she said, look, you've been a survivor up to this point. You've done extremely well. You are not a victim. You need to get your act together, get back on your protocols because they worked for you until you fell in the bathroom, and let's see where we go with this. So she gets a nurse to stay in the house to help me. I am catheterized. I have to use a bedpan. It is so demeaning. Life was so demeaning at this point. So she gets a physical therapist that helps me tremendously within a couple weeks, I get out of bed, I get rid of the catheter, and I'm starting to walk with a walker. And I'm doing well, and I can even walk outside with a walker. So I'm reviving very, very well. And I revoke hospice at that point. No, in October or so, I see my oncologist, and he's kind of amazed where I am at this point. And he finds a form of immunotherapy drug. It's not chemotherapy, it's an immunotherapy drug, which actually is a monoclonal antibody that supports my own immune system by killing my malignant plasma cells without destroying other healthy cells. Chemotherapy destroys everything. So I go on that, and I'm continuing that, continuing with my protocols. I'm doing very well, and I'm reviving. My energy and my physical structure is just thriving now. So in May of 2020, my oncologist wants to get another x-ray, the PET scan, to see where the cancer cells are. And he calls me that evening after I do the PET scan. He says, make sure your wife gets on speakerphone. And he says, and he's reading the radiology of report, and he says, there are no active cancer cells within my entire body. Wow, this is amazing. Now, I'm not in remission, I'm not cured, but I'm doing exceptionally well.
Wow, that's amazing. That's amazing.
So my diet for all this, I was on paleo. When I was diagnosed, I switched to a paleo autoimmune diet. And on January 1st of 2020, I switched to the carnivore diet for a variety of reasons, but mainly for cancer. And there's some phenomenal, excellent cures that are being reported in Budapest, Hungary, through a clinic called the Paleo Medicina Clinic. Amazing. That actually have shown cancer patients, incurable cancer patients, getting not only remission, but getting cured with this very strict animal-based diet that they use. So that encouragement started, and that's where I am now. I'm eating diet and doing my other protocols.
Well,
so that's
an amazing story.
Really
yeah.
Amazing.
That is amazing. And the Paleo Medicina group, I'm big fans of them, and I think they're doing amazing things. And I think they're going to be the poster child for how to do maybe medicine in the future, I think.
Well, let me tell you something interesting. They post on their website some of the reports that they do and other things. So they just posted in March of this year a case report that is phenomenal. It's a 52-year-old man who had bladder cancer years ago. It was treated medically, and then he developed glioblastoma, and he was treated surgically with radiation and chemotherapy. He went into remission, and 5 or so months later, it came back, and he completely rejected all that conventional treatment. Apparently went to Paleo Medicina Clinic. They put him on the Paleolithic ketogenic diet. That's their animal-based diet. No supplements, no medications, and the report was published with 38 months of him being in remission from this diet alone with glioblastoma.
And just for our listeners, that's a very aggressive
the prognosis,
cancer, right? Very aggressive brain cancer. Is that
correct?
It
is the most aggressive cancer in the brain, and everybody dies.
Wow.
So I should say at least most people die, and the life expectancy is very short. This is amazing, and they just published it. So there's something going on with our body when we eat the foods that our primal ancestors were evolved to eat, and really our DNA, our blueprint, the thing that makes you, you, and me, basically tells our body, this is what I must have. And it also tells our body, this is what I cannot have. And anything in between is okay. Some better than others, but it's okay. So we always need to drink water. We always need to breathe oxygen. We always need nutrients for our body. If we don't get those, we're going to die. On the other hand, it knows that there are certain things out there that it has never evolved to digest completely. And if you eat those foods, you can call them foods, but they're toxic elements. The DNA is basically telling you, I can't survive. I'll give you a little time to get your act together, but if you keep doing this, I'm going to get pretty sick and you're going to die. And it's that concept that makes sense to me. And nobody can fool Mother Nature anymore. You can do anything in between these extremes, but you have to have water, you have to have nutrients, you have to have oxygen, but you must not eat or consume certain toxic elements the body cannot deal with. End of story. So we are really physiologically designed to be more animal-based than plant-based, but we're omnivores, so we can eat plants to a small extent, but not a large extent. And plants, as you know, contain chemicals, proteins that we can't deal with. Some cooking methods can reduce them, but we cannot deal with it. We can't deal with phytates, we can't deal with oxalates, we can't deal with lectins, we certainly can't deal with gluten. We don't have the method to detoxify, break down these food products that we're eating every day of the week. So by eating a carnivore diet, I'm eliminating all these anti-nutrients that are in plants. And the beautiful thing is the animals that eat plants, they have a stomach and a digestive system to break down these anti-nutrients. All the minerals get absorbed into their meat, which is okay, but more importantly, their fat, their organs, and their collagenous parts. And when we eat all of those, all these nutrients are biologically active to us, but none of the anti-nutrients are there anymore. And if we don't insult our digestion with these unhealthy foods, we're going to do quite well because our gut epithelium heals within 3 to 7 days. It's the most regenerative organ in our body. Wow. So if you ate junk today, but tomorrow you were eating really clean and you did that for the next 7 days, in 7 days you'll have a new gut lining. Wow. That's amazing.
That is amazing. Wow.
But if you stay, it won't be healthy.
Mm-hmm. And so that speaks to the idea of having a cheat day every couple of days.
Makes no sense.
It makes no sense. It's just absolutely
if you see food as medicine, which is what I see food as, I'm not going to be able to do that and survive or thrive. I can maybe survive a little bit, but I want to thrive. Cheat days don't make sense unless you don't care about your body or you haven't been motivated yet. And something, unfortunately, in your life, like a life-threatening event that happened to me, gets you on the right track. But sometimes it's too late.
Yeah. So do you think I think it's probably a combination of the meat itself being so nutrient dense, being so good, valuable for us, but also we're getting rid of the other crap, right? Is it just the best of both?
So you have to get rid of the crap and you have to have the right nutrients. It's like if you had a splinter in your finger, let's say, and you were extremely healthy, doing everything possible to make your body healthy, but the splinter was in your finger, you will still have it in the area of the splinter no matter what you do. Now, take the splinter out, it will heal. However, if you take that splinter and keep stabbing in the puncture wound that you put in there originally and keep doing it day after day, just once a day, every day, that hole will never heal. So if you put irritants in your gut, you can call it a cheat day. You put irritants in your gut, you're going to stab that epithelial lining, you're going to damage the microbiome, and you're going to create all kinds of systemic inflammation that goes everywhere. And your adaptive immune system is going to create antibodies that eventually will get to a point where they start to affect their natural proteins, and then they eat up your natural proteins that are being broken down from the chronic systemic inflammation, and you'll develop autoimmune diseases. So you have chronic disease, autoimmune disease, a leaky gut, a healthy, unhealthy gut microbiome. You're literally on your way to death. I don't want to be there.
I hear you. So Doc, what do you think as far as, it seems like all the crappy food we have or all the environmental things, it seems like almost everybody manifests it in a little bit of different way, right? My disease may manifest as obesity. I may be lucky, but the other guy may get diabetes. Do you think it's just a genetic kind of a...
So genetics play a role, and this is where the genetics come in. So you have maybe genetic dysfunction, little changes in the genetic codex that's not serious, but it may make you more prone to this or that. And when you have this systemic inflammation, it automatically goes to the weakest link in your body to get you unhealthy. Now, there are other factors. I mean, the gut and the food, I mean, the food that you eat is not everything that damages your gut. So poor sleep habits, improper exercise, not able to deal with emotional stress, it's a huge factor. You can have the healthiest body, but if you have excessive continuous stress, you will do the same damage to your body if you ate McDonald's all the time.
Wow.
So you've got to make sure all of these elements that are literally insults to your gut are under control as best as you can.
Wow. Yeah. Now, Doc, I want to circle back quick to dentistry if I can. One of the first things that I started questioning when I kind of stumbled upon keto and the low sugar and the low carb thing, one of the first things I questioned was, wait a second, what the heck is going on in dentistry if dentists know that sugars cause cavities, right? Is it just a matter of like what's going on?
Well, I'm not so sure, sadly enough. Not so sure, sadly enough, that most dentists understand that sugar causes cavities. I think a lot of dentists think that we are deficient in fluoride, and we need fluoride, which that, by the way, is a joke. It's
wow.
very unfortunate. You cannot have decay unless you have sugar problems, but that's not the beginning of the problem. All oral disease, periodontal disease and dental decay, starts with dysbiosis in the gut. That's where it starts. And that creates an inflammatory response that affects the immune system, creating the systemic inflammation that I told you about. And then certain things leak out into the bloodstream, one of which is extremely toxic, called lipopolysaccharides. Now, lipopolysaccharides are the actual cell walls of gram-negative bacteria that have died. We have plenty of that in our gut, and when we eat and we eventually go to the bathroom, all that goes away, and it never gets into our blood system. But when you have damage to the gut microbiome and you have a leaky gut, this lipopolysaccharides leaks into your blood system, and it's called metabolic endotoxemia for a long term, and that is extremely unhealthy, and it affects every organ system, including the mouth. And it makes the mouth bacteria, which is maybe 700 or so species, become unhealthy. Now, let me tell you, dental plaque, this film around the teeth, this biofilm, is healthy until it's not healthy. You do not want to remove healthy dental plaque. Dental plaque, if you go to your hygienist, she'll scrub it off, and then they'll give you chemicals to use at home so that it never forms again. That's the worst thing you could do. Dental plaque has three main functions. And like I said, it's a healthy biofilm in the body. Not all biofilms are healthy, but this is a healthy biofilm. It's made up of 700 or so species of bacteria. They all work in conjunction. They're in balance. They're in a state of homeostasis. So what they do is they're like the gatekeepers for minerals. So the minerals in your saliva that pour into your from your salivary glands that pours into your saliva slowly seep into the dental plaque, and the dental plaque allows them to go into the root surface to remineralize the tooth as you need it 24 hours a day, 7 days a week. The other thing that this bacterial film does is it produces its own forms of hydrogen peroxide. Well, its own forms of hydrogen peroxide kill other potential pathogens in your mouth that want to get into the gum surface. So it cannot get into the gum surface because this destructive hydrogen peroxide that is being created by the healthy dental plaque prevents that. And the third thing that it does is there are chemical buffers in the dental plaque, and these chemical buffers actually keep the acid level to a level of 5.5 or less, meaning that there's no acid to dissolve the root, therefore you can't get root decay. So it maintains a balance of the healthy acid level. If you remove this dental plaque and you don't do anything other than remove it once, it's not a big deal because it regrows in 12 hours. It is constantly regrowing in your mouth. But if you were using chemicals, chemical rinses, even food chemicals like xylitol in sugar and gum, it will destroy the dental plaque's ability to attach to the root. Now, a lot of dentists think it's great because you won't get tooth decay. Yeah, maybe you won't get tooth decay. However, you're damaging your gut microbiome and your mouth microbiome that affects every other microbiome in your body. It's like if you had some bugs in the house and you want to get rid of the bugs, well, you could burn your house down, but that's not going to make sense. Let's just get rid of the bad stuff. Well, how do you get rid of the bad stuff? Well, number one, maybe you need to brush and floss or clean your mouth a little better because you're getting an accumulation of unhealthy dental plaque. And you're getting an unhealthy accumulation of dental plaque because number one, your gut is not healthy, although you don't know it. And you're eating junk. You're eating sugar. You're eating carbohydrates. You're eating foods that attach and bind to the minerals that are in your saliva at the moment that literally excrete them from the body and don't get into the dental plaque to get into the root surface. So the important thing is clean your mouth properly, make sure your gut is healthy, and I would say 95% of the adult population does not have a healthy gut. And I'll tell you why. Number one, and the most important reason is, there was a study done in the early 2000s that was published that showed that US adults have approximately 90 or 92% of US adults have some form of gum inflammation or infection, gingivitis. 92%, that's an epidemic. That's worse than the worst epidemic you can imagine. Now, that's easily taken care of if you clean your mouth properly and you get a healthy gut. If you get your gut healthy, that gum disease will go away by itself. You don't have to do anything other than get your gut healthy and start eating a healthy diet. That's all. You don't even need dental treatment if that's that early. But what happens is this, and can become extremely virulent. The bacteria starts to change. The bad bacteria in your gut and the bad foods you're eating make this disease form what's called periodontitis. Now, 47% of the US adult population has periodontitis. That's still epidemic proportions. And that is an infection of the jawbone that not only causes tooth loss over decades, but it seeps into the blood system and it gets to everywhere in your body. Now, it doesn't only go directly into the bloodstream. It also can get into the lymph that eventually into the bloodstream later on, and it actually can penetrate nerve fibers and travels the nerve sheath to other parts of your body, not even going into the blood system. Wow. And if you didn't think that was bad, these bacteria, some of the most virulent bacteria, can actually go into red blood cells, become dormant, and the red blood cells travel to other parts of your body, and then they deposit themselves in other places in your body, and then activate themselves. So this can be a very, very serious disease if you don't get your gut healthy and treat and clean your mouth properly.
So then my next question, Doc, would be, what's the gut health like of maybe the keto people that are on a keto or even carnivore diet compared to the standard American diet? Is the gut health, and then maybe how does that translate to teeth? What does it look like in a carnivore?
So if we look at, we're going to assume that our ancestors, our ancestral lineage that has evolved over a course of hundreds of thousands of years, they were eating theoretically a paleo/ketogenic diet because there were no processed foods, there were no processed carbs. They ate some plants, but they mainly ate animal products. We know that because if we look at archaeological digs and skeletal remains and we do nitrogen testing, we can determine if the protein is from plants or animals. It's amazing what science does today. So they basically were animal-based, although they ate some plants. Well, if you look at their dental skeletal remains, they have lots of tartar around the teeth. Tartar is the plaque that actually calcifies to form tartar. That's what the hygienist cleans off. That tartar is around the teeth and the jawbone, but the jawbone isn't damaged from periodontal disease, and the teeth are not rotted from decay. Now, sometimes they are. Different societies actually did different things that were unhealthy, but for the most part, they were not involved with dental diseases. So if you are eating a ketogenic diet and living a healthy lifestyle and not putting irritants in your gut that's going to damage your gut microbiome, if that were the case, and that's a big if, but if that were the case, you don't have to brush or floss, period. Why would you have to brush and floss? Animals in the wild don't brush and floss, but guess what? They don't get tooth decay and they don't lose their teeth from gum disease unless they're domesticated. Look at our domesticated cats and dogs, especially the cats. Cats are obligate carnivores, which means they only can digest meat. They can't eat, they can be forced to eat, but they don't want anything but raw meat and bones and collagen and blood and all that stuff. So if you look at the bag of cat food, even the best cat food today, or some of the best cat food today, that says it's whatever, primal cat food types. So the first 2 or 3 ingredients are grains. They cannot digest grains, and they get gut dysbiosis and all kinds of chronic disease, and as well, periodontal disease and tooth decay all the time. So wild animals know what they need to do. They never had, they don't have to go to a dental cave to fix their mouth, and they do quite well.
Wow.
Ketogenic people will have healthy mouths.
Yeah, I imagine so. I mean, and then can we even extend that theoretically out to the idea that, I mean, if you're going to be eating just meat and then, like you said, organs and what have you, and you're not
that has to be done now.
Part of it, the whole animal, kind of the nose and tail. That's why I really like Dr.
Right.
Paul Saladino's kind of approach with that. Like you said, if you don't really need to brush your teeth because, like you said, you're not having any of the things that are going to essentially lead to gut dysbiosis.
Okay. Yeah. So we can go to that in the practical, in the theoretical sense, but in the practical sense, no way do you want to not brush and floss and clean your teeth.
Of course.
Because you're going to have food particles, you're going to have stress in your life, you're going to have chemicals that you have no control over, you're going to be bombarded with dirty electromagnetic fields. Come on, we're living in a society where our immune systems are extremely challenged. Therefore, yeah, brush, but don't sterilize your mouth. Never, ever, ever use a mouthwash, antimicrobial mouthwash on a daily basis. Now, if you have infection all of a sudden and soreness, you use a mouthwash for a week to 10 days, okay, you're going to kill bad bacteria, you're going to kill a lot of good bacteria, and it will regrow if your diet is good and you get your gut healthy. But if you do that on a daily basis, you're going to cause lots and lots of medical problems.
Wow. Let's unwrap it if you don't mind. Yeah, can we unwrap that a little bit? Because I think
so here's something very interesting. Paper was published, I don't know, a couple years ago by a group of cardiologists, and they were talking to other medical doctors, and they were bringing up the point that, if your patients have high blood pressure and you put them on high blood pressure medications and you're not getting the result that you should get because these high blood pressure medications do bring blood pressure down, they said, make sure that your patients are not using an antimicrobial mouthwash every day. And here's the reason why. And it's based on other research done several years back. And here's the reason why. There is a pathway, a biological pathway called the nitric oxide pathway. I'm going to get really geeky here if that's okay with you.
I like it. Yes, please.
So when you eat foods that have natural nitrates in them, then your body absorbs the nitrates primarily in your duodenum, and maybe 50 to 60% of those nitrates that are very biologically active now actually get into your salivary glands. Your salivary glands pour saliva 24 hours a day, 7 days a week, like I told you, with minerals. Well, these nitrates, these chemicals, pour into your saliva. There is a layer of gram-negative bacteria on the top of your tongue. And that gram-negative bacteria is natural. It has to be there. And it makes the nitrate, reduces it to another chemical called nitrite. Nitrite Then you swallow, as you swallow your saliva, everybody does it all the time, gets into your gut, and eventually a lot of it gets transformed into nitric oxide. Nitric oxide is critical for cardiovascular health. It's critical for blood pressure control and even control of gum disease. So if you broke the pathway because you literally use antimicrobial mouthwashes all the time, you wanted to have fresh, sweet, minty breath, let's say. So you use a brand of mouthwash that everybody knows 6 times a day just to keep your breath fresh. You're going to kill all of this gram-negative bacteria. You won't have any odor. By the way, most odor in the mouth comes from the tongue, and I'll tell you how to clean that off without killing the bacteria. So basically, you're going to kill all this bacteria all the time. You're never going to have a chance for it to regrow because you're using the mouthwash all the time. So the nitrates that are pouring into your saliva, you swallow as nitrates, and it never changes to nitrite, and it never becomes nitric oxide, and therefore you have an increased blood pressure. And that's why if you're using a blood pressure medication and you're using a mouthwash to kill all these gram-negative bacteria, your natural body's ability to make nitric oxide to reduce your blood pressure is not there, so the blood pressure is going to stay high for that and other reasons that you may be on blood pressure medication. Isn't
Oh
that
my
pretty interesting?
goodness, that is very interesting. And
So
then
you
also
don't want to,
not even help the gum disease that you may be trying to attack anyway, right? It makes it worse. Possibly, is that it?
well, if
Potentially.
you kill the bacteria that cause the disease, you won't have the gum disease. But is that the only thing you want to stop? Because you're damaging all other biological processes. I know how to how to stop gum disease. You have to clean your mouth effectively. You have to eat a healthy diet that's not feeding bacteria, and you have to have a healthy gut so your mouth doesn't ever create an overgrowth of bad bacteria. If you do that, you never have gum disease. If you are unfortunate to get to the point where you have active gum disease that gets under the gum into the bone, like periodontitis, you have now 2 nituses of infection. You have one in the gut that creates what's called leaky gut, get your bloodstream, and then you have one in the gum space, pocket, and that leaks into the bloodstream and other ways like I explained to you. So that is also infecting your body. So if you want to treat your gum disease, you have to treat the bacteria that are bad in the gut. If you want to treat the gut, you have to treat now the infection in your mouth, because they will now communicate with one another and talk back and forth and spread back and forth. That'll be a very unhealthy environment.
That's amazing. And my understanding, like you were saying as well, about the gut health and everything, it changes so rapidly within 7 days,
Yeah,
right? Now, have you
yeah.
seen any of your patients kind of reverse or kind of come?
Oh, yeah.
Yeah, have you seen that?
Yeah. So here's the problem. My patients, when I was seeing patients actively, I don't see patients anymore since my diagnosis, but I was doing it for 44 years, saw a couple. So my patients would come to me to treat their gum disease. They weren't coming to me for a lecture on how to eat healthy, because they didn't understand the relationship. And when I started to integrate it into my practice, a lot of patients that I was seeing just didn't want to see me for that. They only wanted to get their gums healthy. So maybe 5% of the people that I talked to
Okay.
actually went with what I said with a healthier gut. But the ones that did had some amazing results.
Wow, that is amazing. Now, Doc, what do you think is going to be, I guess if I can point to the next question would be, where are we going to go with this? Because the Paleo Medicina group is coming, Dr. Sal Palisado, guys like you, I mean, me, I'm just banging out here. I'm just a guy saying, hey, eat fat, don't be afraid of it, right? I mean, the whole idea of this podcast is because I found out, once I realized that fat was not the enemy. And in fact, sugar is really, if we want to pick an enemy, let's pick sugar if we have to. And then, so where do you think we're going to go with this? When do you think mainstream medicine is going to jump on? I think there's still going to be maybe 10
Ah, well, here's the beautiful thing that I see. Physicians are not going to drive this because they're not getting taught in dental and medical school. Dentists are not getting taught in dental school. Although, let me just give you a little insert here. Dentists are getting smarter, and I was asked by the International Academy of Biological Dentistry and Medicine to write some material for them. So I created the first certification course that they're now offering to all dentists, all dental hygienists, and all dental staff. They will, it's 4 1.5-hour modules of lecture and all kinds of reading material that I created. And if they take the course and then they pass the final exam, they'll be awarded a certified biological nutritional dental professional designation. And it's the first in the entire world. So I think that there are little elements like this that will slowly move. But what really moves the pendulum is that patients are demanding, now that they're learning from the internet and whatever, they're demanding their healthcare professional to look at their mouth and look at their diet. My course that I wrote and worked with the International Academy of Biological Dentistry and Medicine, actually I teach how to do this nutritional counseling in the office. I teach them to do a 3-day food journal for every patient, and to make that 3-day food journal part of their medical dental records and do it every year. Just like if you went to your medical doctor, that you have some blood tests, that's part of your medical record, and they can look at that over 10, 20, 30 years and see how things have evolved. This 3-day food journal is all telling on the kinds of foods and junk or whatever that these patients are consuming. So I think that patients are making demands of the profession, and some that are future minded are looking at this and saying, I need to get some education here because my patient is telling me stuff that I don't know, and they're giving me copies of medical journals that I never even heard of, and I need to get educated or I'm going to fall down, in my knowledge base. And so I think that's going to happen, and eventually it's going to take a long time, but eventually the dental schools and the medical schools will come along.
Yeah. And I wonder like what it takes, sometimes it's like, we often say that oftentimes people need a personal medical crisis in order to change things, right? I know for me, I got a scare and I have a daughter that was born premature, a bunch of things happen, and then you start realizing things, you start, holy shit, I gotta kind of pull my socks up a bit. But I like things like we're saying, I like how Paleio Medicina Group is doing, I like what you're doing, Dr. Mark Sisson is doing it, all the people in the space is doing it. And I think that's one of the best things about the internet these days as well, is that we have the ability to just share this information out. It doesn't take only PhDs and doctors, obviously, to share this information. But Doc, I just want to thank you so much.
There's a difficult element, but there's a difficult element here. And that is, there is the element of the vegan movement that is much stronger than this element. And they have actually a lot of vitriol to people that don't succumb to the idea of a vegan. There has never been a vegan society in all of evolution, at least for the last 160,000 years, that can be determined, that have survived only on plant-based foods. And if you look at our digestive system, we have a stomach that has an acid of 1 to 1.3. It's there to kill microbes that are actually rotting meat foods. Herbivores and most omnivores have stomachs that are only 2, 3, or 4 pH, which is very less acid, and bacteria can get into their guts because they're not eating bacteria like we are eating bacteria. We have a very long and a small intestine that is designed to eat animal products. We have a very short colon because we don't digest plants very well. So our digestive system has evolved to basically be more animal-based, but we can eat plants than certainly plant-based.
Yeah, absolutely. And like you said, I mean, every time I dig into the whole plant-based thing, it seems like it's just big money, big money. It's just another product, right? It's just another ultra-processed. That's the other thing too. I mean, you can't have a vegan product without it being ultra-processed.
I think that's part of the secret, and that is it's very well monetized. There's lots of lots of companies that can process these foods to make a big dollar. How do you process natural beef? You can't. You have to buy the raw beef or the raw organs. Once you cook it and process it and put all kinds of enzymes and preservatives and additives to it, unhealthy food. They can make a profit on it, but it's unhealthy food.
Absolutely, and it is the fight. It's interesting because I'm kind of in an echo chamber a little bit. I'm in that circle where I listen to the paleo guys and the the keto guys and the carnivore guys, and I think that it is growing. But sometimes I have to take a look from outside, right? And I see that the vegan movement is pushed. It's growing, and it's almost like an orchestrated push, almost like a government push. It seems like to me. But is the paleo voice? Are we, or the keto, the carnivore voice? Are we as loud as I think we are?
I think we are louder than we were, but we're not as loud as the vegan voice at all.
No. So that's our challenge.
It is. You make it happen.
I will. I try my best. Well, Doc, thank you so much. Please share with our listeners and our viewers your website. You have a book.
Sure, absolutely, fantastic. So you can reach me at danenberg.com, which would be DRDANENBERG.com. I do consults all over the world. There is a navigation bar that talks about consults if you wanted to do those. I do them with Skype and Zoom. I have a book that was published in 2017 called Crazy Good Living. It's available on Amazon and or any bookseller. And if you do contact me from the website, because there's a contact bar where you can do that, I will answer everybody's questions.
Awesome. Well, thank you so much, Doc. It's been a pleasure. I know my listeners are going to really enjoy this episode.
Oh, well, thank you for the invite. I appreciate it.
Thank you. And have a great day and enjoy. I'm sure it's still sunny there, right? I hope.
Oh, yeah. It's live.
Here as well.
Yeah, it's a lovely day. Yeah.
Awesome. Thank you so much, Doc. Have a great day.
Thanks.
Let's say bye to everybody. And we'll say thanks for listening. Say thanks for listening.
Thanks for listening.
Bye-bye.